Hi, my name is Midori, and I'm going to be talking about laceration repair on adolescents. A laceration is caused from a blunt or shearing force that causes the skin or tissue to tear, and then the patient needs to go seek medical care to have it sewn back up. So, what are the steps to a laceration being done? First, the wound will be cleaned externally, and they will make sure that either the bleeding has stopped or will not start again. And just to make sure all the external debris is out of the way. Next, they will irrigate it with saline solution and disinfectant. This makes sure that no future infections can get into the wound, or if there are anything lingering in there right now. They'll use a mild soap that helps clean the area around the laceration. So next, once the wound is cleaned, they will apply an anesthetic to it through a shot, and that'll be inserted around the wound. This just helps them so when they do go to suture it back up, the skin will be numb. Next, they might clean the area around the wound, so if there's any extra skin or damaged tissue, they can either cut it to make it all even, or they may just remove it fully. Next, they may insert absorbable stitches. This will help bring the layer of tissue back together below the skin, and then on top they will cover it in sutures. These then will be removed later once the skin starts to heal back together. And then they will complete with a light dressing or bandage, and sometimes they might even put an antibiotic ointment to the wound, which the patient will keep on for the next few days. So, different sensory information that the adolescent might feel while they are having this done. It may be cold from the different ointments and antibiotics that are being put onto the wound. It may sting from being touched, and this might cause them pain or uncomfortableness. When they do get the shot of anesthetic, it will probably pinch and make their skin feel numb. And then when they are watching, they might see the soap color, depending on what that is, most likely clear soap, and then a white ointment that might have them react to what's going on. So the different medical staff that are involved in laceration repair, there's a suture tech who assists in the lacerations, is there making sure everything goes good. Different nurses might be in the room just helping and prepping for what's going to happen with the laceration, and then comforting the patient if they need anything, and then the doctors who will place the sutures and stitches in. So why do they need to do laceration repair? If it's a very deep cut, they need to sew the skin back together to make sure no infections can get into the wound. So they'll stitch it back up. Laceration also ensures hematostasis, which is stopping the blood from continuing and then cosmetic results. So by doing this a certain way with the laceration repair and the sutures, it makes the area that the wound happened look normal as possible. They don't want it the person having to live with this giant scar or something. And then it also decreases infections, like we said above, because they make sure the wound is very clean and nothing can get in there and heal properly. So what do we need to know about working with adolescents when they're dealing with this? They have a need for privacy, understanding, to be heard, and independence. So while we're dealing with them in the room, we might not have them for a long time, but we want them to understand everything that's going on and what is going to happen to their wound now and into the future, and different information that they need to know. since they are very independent, sure, their parents will probably be there, but having them be a part of the process and feel like they are being talked to and heard is going to be important for them to feel comfortable with us. So different coping techniques for adolescents. I'd liked a couple of these. So we're going to obviously prepare the patient by preparing them. This could be telling them what's going to happen, showing them the different things that we're going to use on the laceration repair, and just making sure that they feel confident in going into what they're going to have done. We also can use distraction at the same time, though, so by playing different games or having them talk to different people, this can help distract them from the pain or what is to come. With like the shot, they might be nervous about the anesthetic shot or the sutures, so stuff like that, distracting them will be best to keep their mind off of it. Next will be muscle relaxation. I thought this was a good coping skill for them to use during this time because they're probably going to be very tense and nervous. So by practicing muscle relaxation, they're able to take a moment to just relax and make sure that they're not so tense during the procedure. Diaphragmatic breathing. This will also be good for before and after their practice their breathing skills and make sure like this keeps them calm and centered. A stress ball. So by using the stress ball, they could use that in their hand. Depending on where their wound is, they could use the stress ball and squeeze that if they're feeling any uncomfortableness or pain from the laceration repair. And there are many more, but I thought these were like a few of the good coping skills that adolescents can use in the beginning, before they have their repair done and while the repair is happening. Thank you.